There's limited data on pregnancy and COVID-19, but what we do know suggests that pregnant women are no more likely to develop severe illness after that infection than non-pregnant individuals. Pregnant women should protect themselves from COVID-19 just like anybody else, and that means frequent hand washing, and then also washing down those high-touch surfaces with an alcohol-based product. In addition, it's really important to do what's called social distancing, which is to keep yourself out of large crowds and at least 6 feet or more away from other individuals if you can. Although we don't have that much data on COVID-19 and pregnancy, what we do have suggests that it does not cause birth defects. There may be a slightly increased risk of preterm birth, but that's not clear either. If you develop flu-like symptoms, it's important while you're pregnant, it's important that you call your obstetrician or midwife, whoever your healthcare provider is, and discuss your symptoms. It's possible, in fact, that you have the flu because flu is still circulating. And so with pregnancy, we know that influenza can be very serious, and we would treat you with antiviral medications. If it's COVID-19, that is also a possibility, obviously. So it's important to tell your provider before you arrive. It's a little hard to know exactly which appointments. I think that in general, pregnant women have overall between 12 and 14 visits for your routine pregnancy. And I think that it's clear that you don't need all 14 to still have good prenatal care. Which visit can be avoided or which visit can be replaced with a video visit really depends on your particular pregnancy. If you're uncomplicated, you probably can do 2 or 3 visits less, and you certainly could do a video visit. But I think the best thing to do is to call your provider and ask their opinion because they know your history the best. We've canceled the maternity tours during this time to decrease the likelihood of exposures to COVID-19. And in doing so, we've replaced all of the information that you would have gotten on the tour with frequently asked questions, which will be posted on our website. We are reserving those tests for people who are very sick. And if you're pregnant and very sick, then yes, you can be tested.